Depression affects as many as 121 million people worldwide. It is easy to miss the signs, but once diagnosed, it can be treated. Changes in mood and emotions due to happy or sad events can usually be managed by the person experiencing them, but if left unchecked, can spiral out of control and potentially lead to depression. The causes for this can be divided into 3 groups: physical, which can be due to alcohol, drugs, or hormonal changes in the body, for example, as a result of thyroid disease or the menstrual cycle. Psychological, any upsetting events such as bereavement, war, money worries, and divorce. Social issues such as poverty, lack of support, or having few interests can also push a person into depression. So although there may not always be an obvious cause, it is important to learn the most common symptoms. Psychological signs and symptoms include prolonged sadness, having low self-esteem, feelings of guilt, worry and irritability towards others. A lack of employment, motivation and sex drive are also indicators. Physical symptoms may also be noticed, such as slowed movement or speech, unexplained aches and pains, constipation and a lack of energy. Changes in appetite, weight, the menstrual cycle and sleep pattern can all be signs of depression. Lastly, you may be able to recognize social symptoms, such as poor performance at work, difficulties with family life, or reduced hobbies and social interactions. If you spot any of these symptoms, then you must carefully monitor the person for any worsening issues. When gauging the severity of depression, it is important to determine the impact on social and occupational function of the individual, rather than the number of symptoms or their duration. If depression becomes a persistent problem or becomes more severe, you should refer them to the next level of your health system. Finally, there is the possibility their depression may be related to a physical illness such as diabetes or HIV, so they must be investigated further and referred if there is any suspicion of this.